Hair loss after COVID-19. We are presently in the middle of a global pandemic and have been for the past year. Coronavirus diseases or COVID-19 has been shown to cause a wide variety of symptoms. Several studies have shown that people who recovered from the virus reported hair loss. Hair loss is just one of the complications of COVID-19. The virus has caused a multitude of symptoms and after effects, including lingering effects of the disease. The Centers for Disease Control and Prevention (CDC) has announced that hair loss may be one of the potential long-term effects of COVID-19. Experts are of the opinion that the hair loss caused by COVID-19 may be the effect of emotional and physical stress, which leads to a reversible hair loss condition known as Telogen effluvium or TE. Research about hair loss after COVID. Even though there is a lack of scientific evidence as of yet, anecdotal evidence is enough to conclude that COVID-19 can cause telogen effluvium or hair loss. However, how often it occurs or how it affects the average population is still unknown. Some members of a COVID-19 support group called Survivor Corps recently shared their experiences of coping with the side effects of COVID. One of the most common side effects reported was hair loss. A study was conducted in November 2020 that investigated the lingering symptoms and side effects in a small focus group of about 63 participants. Around 24% of the participants, 14 participants reported hair loss, but hair loss did resolve in 5 of the 14 participants. What is the link between COVID-19 and hair loss? But what may have caused hair loss in COVID-19 patients? Doctors have reported that the hair loss that is reported as a side effect of COVID is consistent with a condition known as telogen effluvium of TE. TE or telogen effluvium is a temporary condition in which people may experience excessive hair loss after a stressful life change or traumatic event. In TE, hair typically falls out in large patches or clumps while brushing or combing. Those who develop TE report noticeable hair loss 2 to 3 months after the triggering event. Telogen effluvium affects the scalp and lasts for about 6 to 9 months. After the period of 9 months, the hair usually grows back again. One of the major triggers for telogen effluvium is a stressful event and acute illness with fever. Thus, it makes sense for COVID-19 patients to develop telogen effluvium. Another potential trigger for telogen effluvium is excessive stress. Experiencing an illness such as COVID can be a major stressful event for most people. It can cause both physical and emotional stress. In fact, in some cases, people have reported hair loss due to the stress of quarantining and self-isolating as well. Overall, dealing with a global pandemic like the COVID-19 can be a major stressful event for most people. Thus, hair loss during such a stressful time is inevitable. What is the science behind telogen effluvium? In a healthy person's head, about 85 to 90% of the hair is in the active stage of growth, or the anagen phase. The remaining 15 to 10% of the hair is in the telogen phase, which is the resting phase. Hair loss is normal since the hair remains in the active anagen phase for about 2 to 4 years before slipping in the telogen phase, where hair strands fall out to be replaced by new ones. In telogen effluvium, more hair strands go into the telogen or resting phase, causing hair to fall off. This happens particularly from the top or roots of the scalp. Several factors may contribute to this condition, including physical trauma, excessive stress, major surgery, drastic weight loss, hormone changes, serious illness, and iron deficiencies, etc. This is the logic behind how COVID-19 can cause hair loss by sending the scalp into the state of telogen effluvium. However, there isn't much to worry about, as telogen effluvium is a temporary condition and lasts for only about 9 months. What you can do? As we said, telogen effluvium is a temporary condition and will resolve on its own. In fact, the best thing to do when you experience hair loss due to COVID is to wait it out. In addition, you can try a few home remedies that may boost hair growth in the anagen phase. Number 1. Lifestyle changes. You will notice a significant improvement in your hair when you make better lifestyle choices. In fact, Improper grooming practices can contribute to hair loss and aggravate telogen effluvium. Avoid practices that may be harsh on your hair, such as don't pull or tug your hair while combing. Use paraben and sulfate-free shampoos. Don't use too much artificial hair product or go for tight hairstyles. Avoid getting hair treatments like perms done for some time. Number 2. Home remedies. Several home remedies and alternative treatments are available to treat hair loss caused by COVID-19. These include vitamin D and fish oil supplements, onion juice, hot oil treatments with natural oils, herbs like saw palmetto, burdock, bhringraj, shikakai, etc. Ayurvedic head massage, amino acids, rosemary oil, healthy juices that promote hair growth. In addition to these supplements, you should consume a healthy balanced diet rich in protein and fiber. It may also be time to give up your reckless lifestyle habits like smoking, alcohol, and drug abuse. Overall, while recovering from COVID, try to live a healthy and active lifestyle. Number 3. Minoxidil or Rogaine. Over-the-counter hair treatments like minoxidil are proven to be useful when it comes to treating hair loss for both men and women. You will easily find minoxidil in drugstores and supermarkets in the form of topical creams, shampoos, foam, etc. Number 4. Devices. Research has shown that hair growth devices like microneedling and laser caps and combs can be effective for at-home hair loss treatment. However, you should consult your doctor before you try any device or minoxidil for hair growth after COVID. This is everything you needed to know about hair loss and COVID-19. For similar videos, check out our YouTube channel. That's all from us today. We want you to know that your voice is important to us, so please leave a comment below. If you are new here, then click the bell icon for notifications of our new videos and subscribe to our channel.